Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of opium poisoning. Specific antidote. Naloxone is used 2 milligrams IV as specific antidote. Nalmefene is used for longer duration of action. Medico-legal importance of opium. Opium is an ideal suicidal agent. It can be used as drug of choice for active euthanasia. It is an ideal infanticidal. Opium withdrawal. Opium withdrawal is called as cold turkey. In opium withdrawal, the patient has fear, sensation of chills, and goose skin is seen. Test to detect opium is Marquardt test.
thank you and thank you for watching.